Hey there, I want to share something important that's happening in California right now. It's a story that affects millions of people and could have ripple effects across the nation. It's about Medi-Cal, the state's healthcare program for low-income residents, and why it's suddenly in the spotlight. So here's the deal. Medi-Cal is a lifeline for many, but it's also facing some serious challenges. Medi-Cal is facing a massive budget overrun of $2.8 billion. That's a staggering number, and it's raising a lot of eyebrows. That's billions with a B. And it's not just a one-time issue, it's part of a larger trend that's been building for years. The program was budgeted at $6 billion for the fiscal year, but they've already burned through that and needed an extra $6.2 billion in loans just to stay afloat. This kind of financial strain is unprecedented. Yeah, it's serious. And it's not just about numbers on a spreadsheet, it's about real people and their access to healthcare. Now, why is this happening? What's driving these skyrocketing costs and budget shortfalls? Well, there's a lot to unpack. For starters, healthcare costs across the country have been rising steadily, and California is no exception. A new law passed last year allowed undocumented immigrants to enroll in Medi-Cal. This was a bold and compassionate move, but it also added significant pressure to an already strained system. And while Governor Gavin Newsom admits that this is part of the issue, he's also pointing to rising healthcare costs nationwide. It's a complex problem with no easy solutions. It's like a perfect storm of expenses hitting all at once. Rising costs, increased enrollment, and outdated budget forecasts have all contributed to this crisis. But California's Republican lawmakers want answers. They're not convinced that the state has done enough to manage these challenges effectively. They're demanding a state audit to figure out what's really going on. They want to know where the money is going and why the program is so far over budget. They're asking some big questions that could reshape the future of Medi-Cal. How many more people are expected to enroll in Medi-Cal? What's being done to control these skyrocketing costs? And why were the original cost forecasts so off the mark? These are not just political questions, they're questions that affect the lives of millions of Californians. Leading the charge is Assemblyman Carl DeMaio. He's been very vocal about the issue, even grilling state budget officials in public meetings. And he's not alone. Several other lawmakers have signed on, pushing for transparency and accountability. They believe that without a clear understanding of the problem, there can be no real solutions. But here's where it gets tricky. Governor Newsom's office says they're working on ideas to control spending in the long run. They're promising not to cut essential services for Californians, but that's easier said than done. So, it's a balancing act. How do you rein in costs without compromising on healthcare for those who need it most? At the heart of this issue is a question of priorities. Who gets access to healthcare and who should foot the bill? To some, extending Medi-Cal to undocumented immigrants is a compassionate and necessary move. To others, it's an unsustainable burden on the state's budget. Now, I'm not here to tell you what's right or wrong, but one thing's clear. California is at a crossroads. The decisions made now could shape the future of healthcare in the state for years to come, so what do you think? Should every effort be made to rein in Medi-Cal's costs? Or is this just the price of ensuring healthcare for everyone, regardless of status? Drop your thoughts below, and let's have a conversation. Thanks for watching, and don't forget to like, subscribe, and share if you found this video helpful. See you next time.